Good afternoon. I'm Angela Brown. I'm one of the co-directors of the Office of Faculty Development along with Mario Castro. And thank you for coming for this Clinical Educator Portfolio Workshop. You should have all gotten a packet when you came in. And in your packet, you have a copy of the slides that are going to be presented today, as well as the agenda. After I give a brief introduction and Dr. Frazier goes through some general information about the promotions process and what's the difference between your CV and your CEP, we will break into small groups. And on the front of your folders, you should have a yellow sheet of paper indicating which group, which preceptor's group you will be in, and afterwards we'll tell you which corner of the room to go to. So we really hope you'll take the opportunity to ask questions in your small groups and get some constructive feedback, not only on your CEP, but a lot of times you can get a lot of good information just listening to the comments from others as well. But definitely feel free to ask plenty of questions. And this program is presented by the Office of Faculty Development, and our goal is to help you with your career development, both professionally and personally, and provide resources and information that we think will be useful to you in order to make sure that you're successful in a very supportive environment. I really do encourage you to go to our website, ofd.worcester.edu, because I think you will find some really good information there. We try to keep it up to date with a calendar of events when you first log in on that front page of what's happening in the upcoming weeks or so. But everything that you're going to hear today is on the website as well. And in one of the next couple of slides, that direct link to that tab is there. If you have other questions about your CV or your CEP, there are examples posted on the website, as well as videos from previous sessions where we did a more didactic lecture series and went through every single step of the CEP. So you can probably fast forward through that web link to get to the section where you actually have specific questions if you want to hear what the explanation is about that particular session. So without any further ado, I bring Dr. Frazier.
Thank you, Angela. I appreciate it. And hello to all of you. I hope you all know who I am. If not, I'm the chairman of medicine, and I should know all of you. So if you feel like you don't know me, come down and let's talk, because I want to support your career and your career development here, and that's, I think, very important to all of the section heads, the division heads, as well as myself. This is a joke, but I think it's worth showing because I think many of us feel this way, and getting ahead in academic medicine is not just about working harder and faster. I think our goal is to help people work smarter, but also to document and keep track of what they do. Because when I sit down and talk with faculty members and their CVs appear a little thin, and they haven't really kept track of what they do, but when I ask them questions, they can tell me incredible activities and accomplishments and lots of examples of their productivity. So I want to help you and help your trainees think about how they should keep track of their activities from the get-go, because it's much easier if you do it from the very beginning than if you're trying to recreate it years later. So the fundamental ways that we track people's accomplishments and what we use to describe people's careers are the NIH Biosketch, and the bad news about that is the NIH is changing the format again. So this will be the third time in less than 10 years they've changed the format. So if you don't have your Biosketch in the new format, look up on the NIH website, because grants going in after May for all training grants, all R01s will need the new NIH Biosketch format. It's not horribly different, but it is painful enough that you'll have to change it a bit. And then your CV, which is actually a really great document, and I think is consistent for most institutions and across departments, but really focuses on academic careers. And so there's a heavy emphasis on grants, on publications, on your training committees, but not so much on what a clinician educator might do and many of the other educational, clinical, community service activities, care paths, patient safety, quality activities that many of our physicians do. Hence the evolution of the Clinician Educator portfolio. And this is relatively new at WashU. Some institutions have been doing this for a while. Pediatrics was actually the first department to do this and to really hardwire it for their promotions process over the past several years. And the Department of Medicine has incorporated it just over the past couple years, so this is new for a lot of people. But most of the promotions and ad hoc committees are now getting very used to it, and so they're looking for it. And we will not put anyone forward for promotion on the Clinician Educator track who does not have a Clinician Educator portfolio, because it's very important. It really helps the committees understand what you do day to day and the important impact of your work. For those of you who do research and who participate in grants in any way, even if you're not the principal investigator, you should have your other support document, and that also should be kept up to date so that it's clear how your sourcing is for different grants that you have now as well as in the future. And then trainee tables, I think, are incredibly important for everybody who does federally funded research and who has trainees, graduate students, postdocs, mentees. But increasingly, it's important, not necessarily in exactly the same format, but for clinician educators, because many clinician educators mentor and train lots of medical students, house staff fellows in clinical projects, and so I think you want to keep track of that as well. And then the other things that are really critical for you to think about, and you need to either embed with a tracking mechanism in your phone or in your calendar or, on paper, is what you do with your time, your percent effort for giving lectures, for teaching, for your academic work, your scholarship, your administrative work, and also your community activities. Many of you do a lot in the community, and often people don't put that down at all, and yet it's very important and well recognized here. There are community service awards, and so we want to know if you're teaching in middle schools, high schools, if you're working in your church, your religious or spiritual organization, your synagogue, if you're doing things in public health. That's really important to keep track of. And then your scholarship, fundamentally is your research projects and how that's disseminated through abstracts, presentations, talks, locally, regionally, nationally, and then your honors and awards. And when you start out, it seems thin. It is probably 1 or 2 pages when you start. But over time, if you set it up right, it becomes really very structured and easy to track your career progression. So this is my other joke. But I have felt like that in academics, we have not done a good enough job actually teaching people how to give performance appraisals, how to set annual goals and expectations, and how to get people to solicit feedback. So it is always amazing to me when I sit down and give people feedback that appears like it's something that's been an issue for many, many years, either as a strength or as an opportunity. And I'll say, who else has ever talked to you about this? Have you been working on this, or have you kept track of this? And they'll say, no one has ever talked to me about that. And I'm like, really? How could that possibly be? But I think we have assumed that you're all super high achievers, high performers, and that we don't actually sit down and structurally give people enough positive feedback as well as coaching about what they could do differently to be more effective. So I think it has to go both ways. All of us should be getting at least annual performance evaluations, and those should be scheduled by your section head, your division head. If they are not, then you should be reaching out and scheduling it. So, I think particularly for young people, it is really important for you to give as much information to your direct reports as you can about your successes. So you need to show them your data, your progress, your honors, awards, and when you do that, I think you can't just show up. You have to have an agenda, what you want to talk about, your accomplishments, and also things that you think are concerns that you want to ask for help with, how I could get better, and then think about doing your own self-appraisal so that you can have some self-awareness about your strengths, your opportunities for people to respond to. And then ultimately, you have to make sure that your goals and your division or section head's goals are aligned. Because for optimum productivity, you guys want to be on the same page about how you're spending your time and what you're doing so that they are really appreciative and recognizing what you're doing. Sometimes there is a big disconnect, actually, between how people are spending their time and what they should be spending their time on. They may be spending a ton of time on something they love or actually something they hate, like emails. But somehow it just subsumes them, and then they don't have enough time for other things that are really important, like writing or mentoring other people, or actually doing their scholarship. So sometimes you have to really do a time check and really look at how you are spending your time and using your protected time. So there are documents in your folder that outline the appointments and promotions process, what's called the APGAR document here at Washington University. And it is a pretty structured process. There are clear criteria for promotion on the 3 tracks: clinician track, investigator track, or tenure track, and the research track. They are slightly differently applied for every department, but the fundamental process is the same. In medicine, the division chief and I review everybody's CV and everybody's annual update every year in the fall. And we do that in a structured way where we talk about each and every faculty member. And ideally, it's not only their CV, but it's their clinician educator portfolio. And when we go to put people up for promotion, what is in that portfolio or the package is their CV, their CEP if they're a clinician educator, a series of letters, both from the inside and the outside, and also select manuscripts, so that the ad hoc committee that then reviews that portfolio, that's what they have and what they see. And they look at it very carefully and actually read it. And people are looking for reviewing candidates for promotion in a number of areas of excellence: clinical excellence, educational excellence, research excellence. And based on what track you're on, the relative weights of those different pillars are weighed in terms of people's promotion. So when we put people up for promotion, they first go through our internal department committee, which consists of all the division heads. And then once they are approved and reviewed for promotion there, then they go to the ad hoc committee. And the ad hoc committees are pretty much run the same for all the departments. Ad hoc committees consist of 4 to 6 department chairmen, 2 to 4 senior faculty, and then the department chair that's putting people up for promotions goes with the packet of all of their faculty that are being put up for promotion. I present each and every candidate and describe their strengths, why I want them promoted, what their accomplishments have been. I take any questions, and then I leave. And for the Department of Medicine, we do that 5 times a year, and we talk about 30 to 50 faculty members in a booklet each and every time. After I leave, then the committee discusses the strengths and opportunities for each of the candidates and votes on each candidate. They call me later that they're approved or they have questions or concerns. Once they're approved, then it goes to the executive faculty for approval, and then it goes to the board of trustees. So it is not a swift process, unfortunately, and it is somewhat bureaucratic, but it is the same for all departments. And so the more structured and efficient we are from the beginning, the greater the success. So this timeline just clarifies for people what really counts as you move along, and this is for a tenure track investigator. So the tenure clock starts on July 1. Even if you're hired in October 1, the clock starts July 1, which is our academic year. And then if we're going to get this person promoted, I have to have all the paperwork, their entire portfolio together between February and March of 2017, if they started in 2009. The Board of Trustees, the last possible Board of Trustees meeting for them to be approved is March of 2018, and that's when they would be approved. So the process takes 6 to 9 months after I get the full packet. And the executive faculty doesn't meet during the summer. The Board of Trustees doesn't meet during the summer. So the summer is kind of a dead time. So that's why, it's very important for these decisions and these discussions and the preparations actually to be occurring well in advance of when you want the promotion to happen. Now, before it can move forward from my office, I have to have everything intact. I can't be waiting for letters or hoping or, the letter is in the mail. It doesn't really work because these have to be sent out in their entirety to the whole ad hoc committee for review. So they need to be perfect. And I must tell you that I spent a long time in the first few years when I was in this job really micro-editing everybody's CVs and clinician educator portfolios, and that was pretty entertaining for a few years, but it's not fun anymore. So I'm not micro-editing. So if there are errors in people's CVs, if I see anything at all, I just send it back and say, unacceptable, you got to fix it. Sometimes it comes back 3 or 4 or 5 times before it looks good enough to go in. That's really bad. People take these very seriously, and they pick up every spelling error, every inconsistency, every duplicate paper that you put in there. And so you really want this to reflect how meticulous and detail-oriented and successful you are. So the more effort you put into having this look good, the better, so we can move it forward. So there are standard formats for the WashU CV. This is not a time for, pink paper or colorful graphics or, special smells. That may work for Legally Blonde, but not good in this setting. So, and I'm not attached to having the outline format with, numbers and letters and sort of Roman numerals, because that just ends up wasting space. But I think it really should look quite professional, should have thematic domains which are clear in terms of people's education, their clinical experience, their administrative experience, their grants, their publications, et cetera. But you can see the formats there. And we have lots of examples on the website if you have any question. Now, the Clinician Educator portfolio also is now required for us. And so it's really a supplement to your CV. You don't want to duplicate everything that's in your CV. It should go into much more detail about your clinical and educational contributions, your administrative contributions, your community service, in a way that really, there's no space for or no mesh heading on your CV. And so your publications really don't need to be in here at all. They can all be in your CV. So think of your CEP and actually your CV as a real-time document. If you update this regularly, it's a lot easier. So either keep things, in your calendar and do it once or twice a year so that you have things. And then, you can use this actually for your career development planning and your meetings with your section heads and your division heads. Many people on their Clinician Educator portfolio put a mission statement in terms of what their focus, their niche, their goals are, how they are committing most of their time in their academic career, what their goals are, what their areas of expertise are, or their theories of teaching and learning. Those are not super long. Those are to give people an overview of how you are focusing your career and how your career has evolved over time. So the CEP really has 3 major parts: clinical contributions, educational contributions, and community service. And if there's some other, domain that you think is really important, administrative, you can certainly, structure that in there. So what we're looking for is really a brief. This is not paragraphs and paragraphs. These can be bullets and phrases of your inpatient and outpatient clinical activities, where you see patients, what kinds of patients, how many weeks on service, and what you do. Now, this may seem really dumb to you because they're like, well, yeah, I do 12 weeks on medicine. Everybody knows what that is. But there is no one from medicine on the ad hoc committee. So they have no clue what it's like, really, unless you tell them. And there are basic scientists there. So you need to help them understand how challenging 12 weeks of medicine is and how sick the patients are, how many admissions, the daily rounds, the teaching, the number of hours. And really, quite frankly, when they read that, you can see their eyes bugging out. They're like, had no idea, and they have much greater respect for the clinicians. So some of these informations about your volumes, any specialty clinics you developed or lead, and we need sort of an evolution over time to see how these programs have grown or how they've been enhanced or expanded. And if you're just starting now and you're an associate professor, you don't have to recreate this, from the birth of time, but you ought to try to go back 3 to 5 years at least. So an example would be on your traditional CV. You might just say general medicine clinic attending at the Center for Outpatient Health. And this example is what would really be in your CEP with much more detail about the time, the number of residents, the number of patients seen each clinic visit, the severity of illness, the complex comorbidities, the documentation, so people really understand how busy clinic is and what kind of care you're delivering. Now, many of you may do quality improvement, patient safety, or things that improve the effectiveness of healthcare delivery. That's really important too. So describe what the area of need was and what you did, and then the impact. So think about if you develop care paths or clinical guidelines, policies and procedures. Those are all valid things to have in a CEP. And then be inclusive. So if it was a one-man show, great, take all the credit for it. If this was a team effort, clearly give credit to all the people involved in the team and what your role on the team was as a participant. So that's clear. So clinical trials also is very important here. It's a key area of scholarship. So for this, you should list the trial name, the sponsor, the funding period, your specific role, the enrollment, and this includes investigator-initiated trials, industry-sponsored trials, and anything that's non-governmental as well. So administrative responsibilities are clearly recognized and valued in the promotions process. So even though it may feel like a squishy task or an underappreciated, piece of work or thankless, it actually is well recognized as an important part of what actually, runs a division, a department, a medical school. So if you're a clinical director, if you run a fellowship or house staff training program, if you supervise nurses, nurse practitioners, describe what you do, the time, the effort, the outcome in your CEP. So again, for your contributions to the medical literature, don't replicate anything that's in your CV. Just put, your publications there. But if you have online submissions, non-traditional publications, educational pamphlets, this is a good thing to put in your CEP. And generally, people like to see it numbered and from oldest to newest, and also to bold your name. That's particularly important if you have had a name change so that people can see the evolution of your contributions with both of your names, pre and post. So the feedback section is a little tricky, and I've seen people do this very well and very poorly. What you want to get at here are how you are evaluated by house staff, by fellows, by medical students, if you have that available, or patient satisfaction and other feedback from patients or families. But what sometimes happens is people request all of their evaluations and then they copy them and attach them. That's not good. No one actually really wants to look through all that. The other thing that doesn't work well is when you pull out all the positive comments and then don't put any of the negative comments. So it's kind of a balance, right? Because you don't really want to put your negative comments in there, but obviously if you only have this long list of all the wonderful comments, people know that you're not giving a balanced view. So I think the best way to do your evaluations is to give an aggregate of your average scores, your percent excellent ratings, and then to have someone who knows you and who can critically review your evaluations write one of the letters, because it actually comes across much better from a letter writer, because then they can go on and on and on and embellish, whereas if you have 20 pages of your evaluations over 20 years, it gets numbing for the reviewers. So for teaching, again, this is a really important thing to describe. And some of it is really keeping track of all the lectures that you give and the audience, the location, the time, but also your roles and responsibilities as a course master, a small group leader, CME courses. Those are all really value added. Sometimes people will say, well, I give this talk on, sexually transmitted diseases. I've given it every year for the past 20 years. I feel embarrassed to put that on there because it's the same talk. I'm pretty sure you're not giving exactly the same talk for 20 years. If you are, you should stop. And so, I don't care if you change the name a little bit, but, most people understand that you're being asked to give this talk over and over again because it's a good talk and you are updating it annually. So figure out a way to document that and take credit for it. Particularly important if you're developing new courses, new lectures, new educational programs. That's a huge amount of time and effort. It is way harder to fix a broken course or to develop a new course. And so you need to really describe the depth and time involved in that, because that is very important. And I think people appreciate that. So if you develop handouts, guidelines, other enduring material, that's all totally important to put in here. And in some cases, you can have the actual document as attachments. I think you have to be a little careful. Some people do a lot of this, and then they have this kind of encyclopedia that they're attaching, which is not good either. So you got to kind of balance how much and have, really high quality, or have web links so that people can look at this stuff if they want, but not overwhelm them and kill too many trees doing it. Again, for curriculum development, describe the course content, the objectives, the time, the duration, and new methods in education are also value added. Just in the same way that you develop new scientific methodology, if you have new educational or evaluation methodology, that should be described. Now, for mentoring, this is recognized at the highest levels of the institution with mentor awards, awards from trainees and mentees. And so you have to keep track of who you mentored, for how long, and for what project. And then also, it is really good if you keep track of what your mentees are doing in the time now, because ultimately, tracking the outcome of your trainees also is very value added. So think about how you can maintain these relationships, and ultimately you may be getting letters from some of your trainees as well. Now, CME also counts. So if you're involved in CME courses, either here, regionally, across the country, that should be listed, as well as descriptions of the participants, the focus, the groups. And then obviously, any honors and awards you have should be on there with a description of what the honor and award is for. So the Goldstein Leadership Award, if you're here, I know that that's one of the most distinguished educational awards, and that there's only one or two given out a year, and they're very competitive. But not everybody knows that. So you need to describe a little bit what these honors and awards mean so that their impact can be fully realized. And then if you're doing things for the community in the lay literature, that also is important and value added. Now, administrative, community service, public service within the institution, I think that people can go after this and take advantage of it. If this is an area that you would like to pursue or that you don't have any experience with, you need to talk to your section head, your division head about what would be a good starter point, how could you gain experience. This is an area for development of leadership. And then if you do, you have to talk. You have to speak up. You have to, try to become the team leader or the chairman of the committee. You cannot sit there and never say anything and just have it on your CV, nor can you not show up, but have it on your CV. So this is meant to be beneficial and not torture to you. So if it's torture, you need to extricate yourself, but use it for a career development opportunity. The same thing for local, regional, and national communities. Getting letters from the outside is very important, and the way to do that is by enhancing your network and meeting people and then keeping up and keeping involved with them over time. And you can do that by engaging them in your career development, in your scholarship, with regular emails, meetings at national meetings. But I think particularly for people who are kind of lifers of WashU, sometimes this is the hardest thing for them because they feel like they don't know enough people outside, or if you're shy, or not super outgoing, this is something you got to really commit to work on. These media activities are increasingly important and popular. You can get media training. So if this is really painful for you, but you think it's important for your career development or your area of scholarship, then take advantage. There's media training on the Danforth campus, but here from the hospitals and the medical school as well. So in summary, if you have not read the APGAR document, it's a little dry, it's a little legalistic, but I think it's really important for you to read and understand what the goals are and how the process works. And then look at the formats and look at other people's CVs and CEPs, people who are much further along than you are, and say, well, this is where I'm going to be in 5 or 10 years. If I start now, I can collect and structure my data collection and tracking tools in a way that will be beneficial. And then work with others. So work with your section head, your division head, but work with others at your level, but also a little bit ahead of you, and people that are your mentees. Because often you underestimate your abilities, and so if you show it to other people, they are more likely to say, well, you do X, Y, and Z, you don't even have it on here, or you have completely minimized your activities in A, B, and C, and this really needs a much better description of where you are. So, other people can help enhance, elaborate, and build your portfolio sometimes better than particularly self-deprecating and humble people can. So I'm going to stop there. Are there any questions? We cut out a bunch of slides because I think it's easier for you just to look at, in examples and to understand if you need specific examples.
So in your packet, you do have the full set of slides that has the examples for each of the different sections.
And you have to have really good eyes because they printed them 3 to a page. So even with my trifocals, I cannot read all of the micro print. However, we'll put it on the website. Jennifer, I'm making fun of the micro printing.
It's actually already on the website. So each individual one, you can just blow it up. But this was just for you to have while sitting here. But it's out there.
I'm just teasing.
I know.
I'm making fun of my bad eyes. You had a question.
I have a quick question about the feedback section. You said that we should have somebody who knows as well write a letter summarizing the feedback. Is that the only format of feedback we should put in the CEP?
No, I think, what also works is, and you should be looking at your feedback from your house staff and the medical students, but they have to do that in a confidential way, so they have to have enough to give you an aggregate report. So if they gave you the feedback after every rotation, you could pretty quickly figure out who said what and it would not be anonymous for the students or the house staff or for you. So generally for the students, the house staff, the fellows, the program directors try to pool the data and have several months or several rotations and then give that to you in aggregate. So you should be getting that. If you are not, you need to ask for it. And then when you get it, it can be aggregated in a way that shows, there's a scale, a numeric scale, and then there are text comments. So you can give, you can say that I did 20 rotations and my average score was 9, excellent in these 4 thematic domains, and here are some examples of the comments that were given. And if there's stuff on there that's a little mixed, then sooner rather than later, I would sit down with one of the program directors and say, okay, I didn't get the best teaching evaluations. I got some that said, that I didn't listen well, or that I didn't give feedback, or I didn't teach enough. Who's a really good teacher that I should talk to about how they structure their rounds or how they run their service so that I could get better? Because, I think many of these things really can be improved upon if you know how and have other examples. Other questions? Okay.
All right, thank you much. And just for your reference, in your packet, there are other materials as well. In addition to the copy of the handouts, the APGAR document is there for those who want to read it late night tonight. How many ever pages it is, so enjoy. But there are also some guidelines on career planning. There's some tips about the CEP. The CEP format and the WashU CD format is there as well. So there's just some other general information. And then the most important thing that's in there is the green sheet of paper, which is the evaluation form. So before you leave, after the small groups, we really would like to have your feedback for this session. You don't have to put your name on it, but please fill that out and give it to Jennifer or leave it on the table outside.